Hello everyone, welcome to the video on GPAT 2022 Crash Course MCQ Series. In this video, I am going to explain previously given pharmacology GPAT questions with answer explanation, and this is part 5. I have already made 4 parts. Please do watch them. This is my YouTube channel. If you like the video content, share the video and subscribe the channel. Let's get into the class. Now, which of the following actions of norepinephrine would be antagonized by prazosin but not by propranolol? You need to understand the question. Norepinephrine will be having multiple actions. It will be acting on alpha 1, alpha 2 and beta 1 receptors preferentially. Beta 2 action is also there. Slight action is there. Now, what is prazosin? Prazosin is an alpha 1 antagonist or alpha 1 blocker. What is propranolol? Propranolol is beta receptor blocker. Now the question asks, norepinephrine action is blocked by prazosin but not by propranolol. That means an action which is specifically produced by alpha 1 receptor will be blocked. Now we need to figure out what is that action is. See, heart rate is related to beta receptor action. Release of renin, beta receptor. Glycogenolysis, beta receptors. Only the leftover one is Mydriasis is caused by alpha receptor action, that is blocked by prazosin. So the answer is Mydriasis. This is an analytical question. You need to understand the actions based on their receptors. Moving to the next one. Now, arginine. Arginine serves as a precursor for which of the following? Now, this is a very popular one. There is something called as nitric oxide synthase enzyme, which is there in our blood vessels and a lot of tissues also. Now, nitric oxide synthase, the job of nitric oxide synthase is it converts arginine to citrulline, and in that process it releases nitric oxide. So arginine serves as a precursor for nitric oxide. So the option C is correct one. Moving to the next one. Now the agent that can only be given intravenously for heart failure is, you need to figure out what is that particular agent is. See, digoxin, amiodarone, quinidine, dobutamine, all of them except quinidine, all of them can be used to treat heart failure. Now quinidine is used to treat arrhythmia. Now, but the question asks about which can only be given intravenously. So you need to find out a drug which could not be taken orally, and that is dobutamine. Because it is orally inactivated, it can only be given intravenously. So the right option is D, dobutamine. Moving to the next one. Now, which hormone works antagonistically to parathyroid? Now, what is this parathyroid does is, see, whenever the calcium levels in the bloods are decreased, parathyroid acts and it increases the calcium levels. You need to understand this. The calcium levels are increased by taking calcium from the bone. So, from the bone, calcium gets into blood with the help of parathyroid. What is calcitonin action? It increases calcium levels in the bone. Look at the difference. So both of them are acting antagonistically. Parathyroid removes calcium from the bone, whereas calcitonin increases the calcium levels in the bone. So which one acts antagonistically means calcitonin. Moving to the next one. Now, synthesis of thyroid hormones is inhibited by all except, see, propylthiouracil, methimazole, perchlorate, all of them can be used to inhibit thyroid hormone synthesis. Now this ditrazate is a diagnostic agent. It is an opaque agent which is used to diagnose images of veins and certain tissues. So this is a diagnostically used. It is not used to inhibit thyroid hormone. So the option D is right answer. Moving to the next one. Now what is Co-trimoxazole? This is repeatedly tested. See, co-trimoxazole, the tri indicates trimethoprim, oxazole is from sulfamethoxazole, and the ratios are 1:5. That means trimethoprim is in 1 ratio, sulfamethoxazole is in 5 ratio. See, this is the answer. Sulfamethoxazole, trimethoprim in 5:1 ratio. None of the others are correct. So right answer is sulfamethoxazole and trimethoprim in 5:1 ratio. Moving to the next one. Adverse effect of cholinesters that may be avoided by selection of appropriate route of administration. See, intravenously given cholinesters will cause rapid changes in body physiology, especially when they act on blood vessel. They indirectly increases the levels of nitric oxide and vasodilation occurs. If vasodilation is there, it will cause prominent hypotension, which is very dangerous. Sometimes it is life threatening also. Severe hypotension may cause coma and death also. So by changing the route of administration, you can change this particular adverse effect, hypotension, because that may result in coma and death also. So the option B is correct one. Moving to the next one. Now, antidote for paracetamol overdosing is, this is a popular one, N Acetyl cysteine. It acts as an adsorbent. This molecule will adsorb paracetamol and get excreted out of the body, and that is how it acts as antidote. Moving to the next one. Now, which one of the following drug combination is contraindicated? Look at them. Glyceryl trinitrate, sildenafil. What does this glyceryl trinitrate does? It releases nitric oxide. What does this sildenafil does? It causes vasodilation. Both of them will cause severe vasodilation, and the combination is very dangerous. So option A is the right answer. This is contraindicated. Amoxicillin, clavulanic acid are used in combination in drugs like augmentin. Clavulanic acid is beta-lactamase inhibitor. Amoxicillin is an antibiotic. Losartan hydrochlorothiazide is widely used to treat hypertension, BP. Pyrimethamine sulfadoxine is a very good combination to treat malaria. So all of them are approved one, but the dangerous combination is this one, glyceryl trinitrate and sildenafil. Which sugar is suitable for diabetic patient? Now see, sucralose is a modified sugar. This is nothing but sucrose. Sucrose is modified by replacing chlorines. Hydroxy groups are replaced with chlorines, and that results in sucralose. Now the advantage is it is at least 300 times sweeter than sucrose. At least, I'm telling you, it is at least 300 times sweeter than sucrose. And the other thing is, it will not get digested or absorbed. It will not get absorbed. So if it is not getting absorbed, it will not increase the levels of glucose or anything else. So sucralose is best suitable to use in diabetic patients because it gives the sweetness, but it will not increase the levels of glucose. Next one. Which of the following is true for natural killer cells? See, the best one is they recognize and kill virus infected cell. So this is the popular one. This is the correct one. So they recognize and kill virus infected cells. Now all of the following ACE inhibitors are products except, now we need to understand this, most of the ACE inhibitors are ester derivatives. The ester is converted to acid form, and this acid form is the one which is active form. Now ramipril, enalapril, perindopril, all of them are ester derivatives. Only non-ester derivative is lisinopril. Along with this, captopril also. So in ACE inhibitors, captopril and lisinopril are the active drugs. Remaining all are prodrugs. Look at the question. It asks about all are prodrugs except, what is that exception? Lisinopril and captopril. Moving to the next one. Which of the following is resistant to both true and pseudocholinesterase enzymes? Now this is a kind of structure based question. The answer is carbachol. Carbachol is carbamyl derivative. It is not an ester derivative, but it has got this functional group. When this functional group is there, esters cannot break the bond easily. That is the reason why they become resistant. Whereas acetylcholine, methacholine, pilocarpine, all of them are ester derivatives. They are easily metabolized by cholinesterase enzymes. Whereas carbachol, you have carbamyl derivative is there, and that is what makes them resistant to esterase enzymes. So option A, carbachol, is right answer. Moving to the next one. Now, zona fasciculata of suprarenal gland produces. Suprarenal is nothing but adrenal gland. Now, in adrenal gland, we have cortex is there, medulla is there. From medulla, adrenaline is released. Cortex, adrenal cortex has got 3 zones are there. Zona glomerulus, zona fasciculata, zona reticularis. Now, this zona glomerulus produces mineralocorticoids, whereas fascicularis produces glucocorticoids. Reticularis produces sex hormones. So the question is about zona fasciculata. What it does? It releases glucocorticoids like cortisol and all. So the option B is the correct one. Remaining C, mineralocorticoids are by zona glomerulosa, sex hormones are by zona reticulosa, whereas adrenaline is from adrenal medulla. So these zones are from cortex. So option B is the right answer. Moving to the next one. Now, actions and clinical uses of muscarinic agonist include which of the following? Bronchodilation? No. Muscarinic agonist will cause bronchoconstriction. Now, improved aqueous humor drainage? Yes. That is the reason why some of them are also used to treat glaucoma, especially pilocarpine is used to treat glaucoma. Decreased GI motility? No, it increases GI motility. Decreased neuromuscular transmission? No, it increases neuromuscular transmission. So the only option left over is improved aqueous humor drainage, which is used to treat glaucoma. Next one. Which of the following drug is not used in the treatment of Helicobacter pylori infection? See, Helicobacter pylori infection prominently causes peptic ulcers. So in order to treat this, you will be using drugs like ampicillin, clarithromycin. Yes, antibiotics are used. Bismuth subgallate is also used because it forms a protective layer over this ulcer and it removes the toxins. Only leftover one is mosapride, which is not used. It is a prokinetic agent. 5-HT4 agonist. It increases GI motility. So this cannot be used to treat Helicobacter pylori infection. So option C, mosapride, is the right answer. Going to the next one. Chemokine co-receptor CCR5 inhibitor is. See, all of them are anti-HIV drugs. Now in this, Enfuvirtide is fusion inhibitor or viral entry inhibitor, whereas Maraviroc is CCR5 co-receptor inhibitor. Raltegravir is integrase, viral integrase enzyme inhibitor. Atazanavir, zanavir, all of them are protease inhibitors. See, all of them are anti-HIV drugs. But according to the mechanism of action, CCR5 inhibitor is Maraviroc. Moving to the next one. Now, local anesthetic with highest cardiotoxicity. See, all local anesthetics will be acting on sodium channels, which are responsible for depolarization and sensation. But other than neurons, one of the drug is selectively acting on this cardiac tissue, and that is Bupivacaine. It has got highest amount of cardiotoxicity. It causes severe hypotension because sodium channels are blocked and it results in decreased BP and hypotension. Remaining drugs, they have very less cardiotoxicity, especially see Bupivacaine. The lipoisomer do not have much of the cardiotoxicity, but racemic mixture of Bupivacaine will causes cardiotoxicity. Moving to the next one. Tranexamic acid is. We need to understand a little bit of physiology for this. Now see, fibrin mesh causes clotting, but fibrin will be degraded with the help of an agent called plasmin. So plasmin is what causes fibrin degradation. Plasmin comes from plasminogen. So plasmin is converted to plasminogen. Now, if plasmin is there, it causes fibrin degradation. This is nothing but fibrinolysis. Lysis means breakdown. So degradation of fibrin is known as fibrinolysis, which is caused by plasmin. Now, tranexamic acid inhibits plasminogen. If plasminogen is inhibited, plasmin will not be there and fibrinolysis will not be there. And what is that process known as? Antifibrinolytic. So tranexamic acid is antifibrinolytic. Now, remaining drugs, antithrombotic, warfarin, heparin, aspirin, all of them will inhibit clotting, and that is called as antifibrinolytic. Now, fibrinolytics, urokinase, streptokinase, all of them will encourage this process. So they cause fibrin degradation. Steptics are the agent which will cause vasoconstriction. They will also reduce bleeding, but by causing vasoconstriction. Usually alums are used. They are nothing but astringents, protein precipitating agents. They will arrest the bleeding. Now the next one. Now, which of the following drug is preferentially used as pre-anesthetic medication? Now you need to understand this thing. All of them are benzodiazepines. Now out of them, the short duration action one is midazolam, and oxazepam, alprazolam are intermediate acting, whereas nitrazepam is long acting one. Now pre-anesthetic medication should act for short duration of action. That is the reason why midazolam is most widely preferred as pre-anesthetic agents. So option A is the correct one. So these are all the 20 previous GPAT questions. Please go through them. If you like the video, share the video and subscribe my channel to get more of this kind of videos. Thank you for watching.